21 ಬಂದು ಆನ್ಲೈನ್ ಇರ್ತದ್ರಿ ಅವ್ರಿಗೆ.
14 days ಕ್ವಾರಂಟೈನ್.
ಆಲ್ಮೋಸ್ಟ್ ಈ ಮಂತ್ ಎಂಟನ ಆನ್ಲೈನ್, ಮುಂದಿನ ತಿಂಗಳು ಥಿಯರಿ ಕ್ಲಾಸ್ ಆನ್ಲೈನ್ ಇರ್ತವೆ. ಪ್ರಾಕ್ಟಿಕಲ್ ಡೆಮಾನ್ಸ್ಟ್ರೇಷನ್ ಅದ ಸ್ಮಾಲ್ ಬ್ಯಾಚ್ ಮಾಡಿ ಇದು ಮಾಡಿ. ಥ್ಯಾಂಕ್ಸ್. Good morning.
Good morning, ma'am.
Very good morning. So I will come directly. Pregnancy tests. It may ask us 3 marks question. So just I will go through pregnancy question. Next my topic is parturition and lactation. So what are the pregnancy tests? Pregnancy tests include immunological tests, biological tests and ultrasonography. Immunological tests is that latest test based on the reaction between HCG and its antibody. It's the latest test based on the reaction between HCG and its antibody. The various immunological tests used are bioassay, immunoassay, that is antigen antibody reaction, and radioimmunoassay, that is radio labeled HCG is used. The commonly used immunological test is called Gravidex test. It is a Gravidex test. What is this Gravidex test? Principle. The urine of a woman with suspected pregnancy is mixed with HCG anti-serum. The urine of a woman with suspected pregnancy is mixed with HCG anti-serum that contains HCG antibodies. Later, HCG coated latex particles are added to this mixture. If there is absence of agglutination, is a positive pregnancy test. Agglutination does not occur if the woman is pregnant because antibodies will be neutralized by HCG present in the urine. What are the advantages? Gravidex test is the most accurate test available. It's the most accurate test available, easier to perform and less expensive. It gives result in 5 to 30 minutes. Disadvantage is proteinuria may give false positive results. Proteinuria may give false positive results. Similarly, the test becomes positive in the presence of HCG producing tumors. Presence of HCG producing tumors. The test becomes negative in the later stages of pregnancy. Biological tests. Biological tests are based on the luteinizing activity of HCG. The urine of a pregnant woman is injected into female animals like mice or rabbit. Occurrence of ovulation indicated the presence of the HCG indicative of pregnancy in the woman. Ashim-Zudite test. In this test, the urine sample to be tested for pregnancy is injected into hemorrhagic spots which indicate the occurrence of ovulation in the mice, which is positive test for pregnancy. Then Fredman test. The urine sample to be tested for pregnancy is injected into a female rabbit. The abdomen is opened after 24 hours. Presence of hemorrhagic spots in the ovary indicate the occurrence of ovulation in the rabbit. Gulli-Manini test. In this, the urine sample to be tested for pregnancy is injected into the lymph sac of male frog. And after 2 hours, urine is withdrawn from the cloaca of the frog. Presence of sperms in the urine indicates a positive pregnancy test. Last one, ultrasonography. Pregnancy can be detected as early as 5th week after conception by ultrasound examination. We'll come to the parturition or physiology of childbirth and ovarian hormones. Parturition is the process of delivery of the baby. This usually occurs after pregnancy reaches term, that is 40 weeks. If the delivery occurs between 28 and 37 weeks of pregnancy, it is termed as premature labor. If the pregnancy terminates before the 28th week of pregnancy, it is termed as abortion. Factors initiating parturition. They are broadly into 2 categories: hormonal factors, mechanical factors. Hormonal factors: fetal hormones, maternal hormones. Role of fetal hormones: increase of fetal CRH, that is corticotropin releasing hormone causes increased ACTH secretion. This increases the fetal androgens. The fetal androgens are converted to estrogens. Estrogen increases the secretion of prostaglandins. Estrogen increases the secretion of prostaglandins. Prostaglandins enhance uterine contractions, which help in the delivery of the baby. Role of maternal hormones. They are estrogen progesterone ratio. Progesterone has an inhibitory effect on uterine contractility. It has an inhibitory effect on uterine contractility. Estrogen has stimulatory effect. Estrogen has stimulatory effect. Throughout pregnancy, both estrogen and progesterone are secreted, but from the 7th month onward, the estrogen content increases and the progesterone are secreted. But from the 7th month onward, the estrogen content increases and the progesterone level decreases. This alteration in the estrogen-progesterone ratio favors increased contractility of the uterus. Effect of oxytocin. Effect of oxytocin. Oxytocin increases uterine contractions by causing direct stimulation of uterine smooth muscle and also by the formation of prostaglandins. As pregnancy approaches full term, there is increase in sensitivity of the uterus to the circulating oxytocin. Increase in the rate of oxytocin secretion. Mechanical factors. Stretch of uterine muscle. This increases uterine contractility. Intermittent stretch of smooth muscle caused by the movement of fetus also cause uterine contraction. Stretch of cervix. This increases uterine contraction. Stretching of nerves in the cervix causes reflex contraction of the uterine muscles by release of oxytocin. That's the neuroendocrine reflex. Braxton Hicks contractions. Braxton Hicks contractions. These are weak and slow contractions of of the uterus occurring throughout the pregnancy. Toward the end of pregnancy, these contractions become very strong, resulting in dilatation of the cervix and expulsion of the baby through the birth canal. Labor. The process of birth of the baby is termed labor. Labor is due to a mechanism of positive feedback. It is a mechanism of positive feedback. The uterine contractions stimulate stronger uterine contractions, subsequently resulting in birth of the baby. The uterine contractions stimulate stronger uterine contractions, subsequently resulting in birth of the baby. The contraction of the abdominal muscles facilitates labor. The process of parturition occurs in 3 stages. The process of parturition occurs in 3 stages. First stage of labor. This stage involves dilation of cervix and opening of the vaginal canal. It lasts for 8 to 24 hours in primigravida. Primigravida means first pregnancy. Second stage of pregnancy. Membranes rupture and the fetal head descends. Membranes rupture and the fetal head descends down the birth canal and the baby is delivered. This lasts for about 20 to 30 minutes in primigravida. Third stage of labor. This stage involves expulsion of placenta. It occurs 10 to 15 minutes after the delivery of the baby. During this stage, about 350 ml of blood is lost from the mother. Involution of uterus. The uterus starts decreasing in size. Uterus starts decreasing in size by 4 to 5 weeks after the delivery of the child. It reaches the pre-pregnant state. This process of involution is facilitated by lactation. The clinical notes: if the uterine contractions are not strong enough, they can be enhanced by giving synthetic oxytocin. If there is no improvement, forceps delivery is done. When you will go postings, clinical side, gynec posting, that time you will learn all these things. If the pelvic canal is small and there is obstruction to childbirth, or if the uterine contractions do not become strong, cesarean section operation is performed. Loss of more than 500 ml of blood during placental delivery is termed as postpartum hemorrhage. We'll come to the another one, 5 marks question. Milk ejection reflex. It is also called milk ejection reflex. Question will come like milk ejection reflex. If they'll ask lactation, you have to write about some these points. Why attendance is so less? Is it you people are already came back to Bijapur?
Not yet, ma'am.
Not yet. When you people are coming?
Saturday, Sunday, ma'am.
Okay, maybe you are near, madam.
Yes, ma'am.
Who are staying far away, they require minimum 3 days. If they will come by flight and all, 1 or 2 days they will require. So other people have come here. Any idea?
No, ma'am.
No. Because nowadays your attendance is very less. I know that these slides will be recorded and they will give it to you. Yes? They will provide recorded slides to you, na? They will not provide? No answer.
Yes, ma'am.
Yes? Yes, ma'am. You are saying something. Okay, I will continue lactation. Lactation is the process of synthesis, secretion and ejection of milk by the mammary glands. I have told that's why it is the ejection, milk ejection reflex also it will be called. Lactation is the process of synthesis, secretion and ejection of milk by mammary gland. The mother's milk has the ideal composition suitable for the infant. Hormonal control. Estrogen causes development of duct system of breast and collection of fat tissue. Estrogen causes development of duct system of breast and collection of fat tissue. Progesterone helps in the development of alveoli of the breast. Development of alveoli of the breast. Prolactin helps in the formation of milk. Oxytocin causes ejection of milk. Oxytocin causes ejection of milk. Development of breasts. The breasts begin to develop at puberty under the influence of estrogen. Breast begins to develop at puberty under the influence of estrogen. During pregnancy, estrogen and progesterone help in further development of the breasts. Growth of ductal system. Throughout pregnancy, there is significant growth of the ductal system. Throughout pregnancy, there is significant growth of the ductal system and stroma of the breasts. A large amount of fat is stored in the stroma. These changes occur due to influence of estrogen. You just, for diagram I have not uploaded. You just go through any book which you are reading. That milk ejection reflex on diagram is there. Baby is suckling the nipple and the diagram showing the how it will the reflex will occur. So please draw that diagram and prepare a note on milk ejection reflex or lactation. Development of the alveolar system. The lobules and alveoli develop under the influence of progesterone. The secretory characteristic develop in these alveoli due to the action of progesterone. How milk is formed? Formation of milk. Prolactin. Prolactin and anterior pituitary hormone is responsible for the production of milk. It is anterior pituitary hormone is responsible for the production of milk. During pregnancy, there is no milk production because of the inhibitory effect of estrogen and progesterone on prolactin. Once the baby is delivered and placenta is expelled, the level of these two hormones diminish and therefore the lactogenic effect of prolactin is seen. Once the baby is delivered and placenta is expelled, the levels of these two hormones diminish and therefore the lactogenic effect of prolactin is seen. The influence of prolactin in the formation of milk is aided by growth hormone. The influence of prolactin in the formation of milk is aided by growth hormone, cortisol, parathyroid hormone and insulin. Each time the mother nurses the child, prolactin level rises and causes the secretion of milk. Expulsion of milk. Milk is secreted by the mammary gland, is ejected out from the alveoli. into the ducts. This is called let down of milk. Milk secreted by the mammary gland is ejected out from the alveoli into the ducts. This is called let down of milk. Milk ejection reflex. Milk ejection reflex. When the baby suckles the nipple, the sensory impulses travel through the somatic nerves from the nipples to the hypothalamus. When the baby suckles the nipple, the sensory impulses travel through the somatic nerves from the nipples to the hypothalamus, which causes secretion of oxytocin. Oxytocin is carried in the blood to the breast, causing contraction of the myoepithelial cells, resulting in expulsion of milk. Oxytocin is carried in the Oxytocin is carried in the blood to the breast, causing contraction of the myoepithelial cells, resulting in expulsion of milk. The average milk production in humans is about 500 to 800 ml per day. The average milk production in humans is about 500 to 800 ml per day. Breastfeeding is very important for both the mother and the child. The advantages of breastfeeding are as follows. The baby gets sterile, easily digestible, nutritive and inexpensive food, which is delivered at the right temperature. It is not night, it is the right temperature. It promotes an emotional bonding between the mother and the child. It promotes an emotional bonding between the mother and the child. Women who breastfeed their babies are less likely to suffer from breast cancer. It is a form of contraception. It provides immunity to the child. In nursing mothers, the ovarian cycle and ovulation do not occur till the mother stops nursing the child. This is because of the inhibition of secretion of FSH and LH. In nursing mothers, the ovarian cycle and ovulation do not occur till the mother stops nursing the child. This is because of the inhibition of secretion of FSH and LH. Nutrition needs of the mother. An average Indian woman doing moderate work requires 2225 kilocalorie per day. It depends upon what work they are doing. It may require less. Sometimes, if sedentary lifestyle is required less calorie. If work is more moderate and severe, they may require more. The energy requirement during pregnancy increases by an additional 300 kilocalorie per day and during lactation by 550 kilocalorie per day. Mothers also require additional amounts of proteins, fats, vitamins and minerals. So, my next topic and last topic in female reproduction is contraception. I will take in my next class. Thank you. Thank you very much.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Thank you.
Thank you, ma'am.